moving in the canal.
Recording in progress.
Okay. This just kind of shows the crystal moving in the canal. It's just a nice video that kind of demonstrates it for you. So how do I treat it? So it's very mechanical. So what we do is we purposefully will put your head in a position to dump the crystal out from that little hiding spot where it can't really get out. And then we slowly turn your head and move the crystal in the canal and move the crystal and dump it back where it belongs. So you can kind of see here is what we do is we turn your head and we bring you down kind of off a mat or off a pillow. I'll put some pillows behind you and we move the crystal from the kind of exit area into the canal. And you do feel dizziness. It's meant to bring on the dizziness. But then what I do is I slowly turn your head and keep moving the crystal in the canal. And then finally, in the final position, you can see here, I actually dump the crystal back into the cupola where the body reabsorbs the crystal. And when we say crystal, but sometimes it could be a couple of crystals. Sometimes the crystals break apart and there's a couple of pieces. But usually within 1 to 2 treatments, it's gone. And once it's gone, it's gone. It's very nice. It's very satisfying as a therapist. It's like 1 or 2 treatments and you feel like $100 again. Okay. So that's the most common diagnosis and thing that patients come in with is vertigo, that feeling of spinning. Now we're going to move on to more so dizziness. And like the second most common thing that I see from patients when they come in and they say, Shana, I just feel really imbalanced. I'm having a lot of difficulty walking. I don't know what's going on, but nothing's spinning. We call this a peripheral vestibular hypofunction. What happens is a virus or inflammation go through your sinuses up into where your vestibular system is. And what it does is it causes irritation of the nerve. So sometimes, because remember, the nerve is shared between the vestibular system and your organ for hearing. So sometimes it'll actually affect your hearing a little bit on one side as well. And what this inflammation and irritation does is it makes it that your vestibular system isn't working the way it should. And it causes misinformation to your brain. So how it does this is when you're sitting still, both sides of your system are firing at about the same rate. When you turn your head, one side gets excited, the other side gets inhibited, and vice versa. When you have an impairment or inflammation or some form of irritation on one side, now when you're looking straight ahead, that one side isn't working the way it should. So when you're just sitting here, your brain is now getting information that you're turning to the healthy side when you're really just sitting still. So it's almost like when you get car sick, it's that misinformation that your body's telling you you're sitting still. Your eyes are telling you that you're sitting still, but your vestibular system is telling you that you're turning. And then your brain, as a way of like a warning sign, almost like how pain is a warning sign that something's wrong, our warning sign is dizziness and imbalance. And then when you go to move and turn, that misinformation gets even worse. So then we kind of go back to those 2 reflexes where if the system isn't working just sitting and your brain's not getting the right information, then your brain can't send out the correct information to your eyes and to your muscles to tell your head and your eyes to move how they're supposed to move. And that's where the imbalance comes in. And that's where, like when you're doing quick head turns, you feel awful because your eyes and your head aren't moving at the same rate and how they should. And your eyes, your body and your head aren't moving at the same rate as they should. So, but the good news is, once again, this is very treatable. Everyone's always so surprised. They're like, oh my God, there's treatment for this. my doctor just gave me meclizine and told me I'd be fine. So the way we do this is we retrain those two reflexes. So there's this exercise that we do called gaze stabilization, which is right here, where I have you look at a target and then you turn your head side to side, keeping your eyes on the target. And what this does is it helps re-strengthen that connection between your eyes and your vestibular system. Now, normally, people can do this about 100 head turns per minute, believe it or not. Usually when you have a hypofunction, you start out at about 40 head turns a minute. I mean, that reflex really slows down. The next thing we do are our dynamic balance exercises. So we do a lot of walking with head turns, standing with your feet together, standing on foam surfaces, standing with your eyes closed. And a lot of that is just retraining your muscles and retraining your balance systems and kind of getting you used to turning your head again. And the more you do these activities, the less error signal is being sent to your brain, and then the better you feel. Okay. So this is something I'd like to touch upon also, is that dizziness is very debilitating physically, but there's also a huge cognitive and emotional component to it, where because your brain is working so hard to keep you steady, you also feel very fatigued, very tired, and sometimes it can be hard to read, sometimes it can be hard to concentrate, and that plays a huge role on your ability to do the things you like to do besides moving around, but also emotionally it can make you feel kind of shut in, more so than we already do during a pandemic. So you're dizzy, so you can't move the way you want to move. Your brain is on overdrive, trying to just keep you steady. So cognitively, you're not thinking 100%. You feel very tired. A lot of people complain about a pressure in their head, and then all those things kind of combined can make you feel very shut in. It's very hard to get out and do the things that you want to do, because food shopping makes you very dizzy. Going out in crowded areas can make you feel very dizzy. And that makes you feel even more shut in and depressed. And it really limits you socially. So I like to add that into this, because there is a huge social and anxiety component to dizziness that people don't realize can be really debilitating. Just some facts, I'd like to throw it out there. 65% of people with dizziness may have a vestibular diagnosis. There are other reasons to cause dizziness, such as medications can make you feel dizzy, blood pressure can cause a little bit of dizziness. If you have diabetes, if you have low blood sugar, can make you feel a little dizzy. There are other medical reasons that you should always go and talk to your doctor about if you're feeling dizzy before trying therapy. But 65% of the time, it actually is from the vestibular system and not other medical reasons causing you dizziness. 30% of people above the age of 70 have experienced BPPV. People may not talk about it, but it's super common. And dizziness accounts for nearly 7 million doctor visits per year in the United States. So you're not alone. So balance, this is a huge thing. As we get older, that fear of falling, it becomes so much more real and so much more prevalent. And if you feel dizzy and you feel unsteady, it only makes it worse. So 30% of persons above the age of 65 fall at least once a year. Vertigo is the most common cause of falls in elderly patients with a vestibular disorder. And signs of a vestibular asymmetry have been shown to be predictors of falls among elderly persons. So if you're feeling any kind of sense of imbalance or dizziness, I really encourage you to go to your doctor, talk to them about it, and find therapy for it, because therapy makes a huge difference. So if you have vertigo, it's a very easy treatment and it's super effective. it showed that there was a significant reduction in numbers of falls post-treatment, 65% over, and it lasts for a whole year. And just in general, I mean, it really helps. This is all from research articles of how much vestibular therapy really helps improve dizziness. It really improves your ability to return to activity, and it really helps reduce your risk for falls. But again, always refer to your doctor, make sure there's nothing else making you feel dizzy, there's no other medical conditions going on before kind of reaching out for physical therapy. So just to kind of go through everything, there's a lot of information I just threw at you. The vestibular system helps us maintain our balance by telling our brain where our head is. Persons with dizziness and vertigo have impaired postural control, making them more unsteady and an increased risk for falls. There is a big difference between vertigo, which is caused by BPPV, and dizziness and imbalance, which is caused by a vestibular dysfunction. And vestibular therapy really helps. And you should come on down. Okay. So if you want, we'll go into questions after this, but if you want to come down for a free assessment and see what's going on, if you guys are feeling dizzy or imbalanced, here is all my information. So that is the phone number to this office. That's my personal email if you have any questions in general about physical therapy or balance or neuro. And then this is the information for our website as well, if you have any other ailments that we can help you with. And then these are just my references. Like a general.
Okay, it went back on. Okay.
The office in Cedarhurst is more of a general outpatient physical therapy office. I'm, as of now in this area, I'm the only one who specifically treats vestibular dizziness. And I'm located in Franklin Square. So it's like about 15, 20 minutes from you guys.
Okay, I do have a comment. Tatiana said, is this something that comes on with age or with menopause?
I mean, age definitely predisposes you to having vertigo. I have heard, so in terms of vertigo and BPPV, age definitely predisposes you. As we get older, it's just that the stickiness of where the crystals are doesn't stay as long. In terms of other vestibular dysfunctions, not so much. It's more of a virus that can cause it. I think as we get older, we're not really able to maintain our balance as well. Our reflexes aren't as strong. So definitely, if you do get a virus, you do get inflammation, I think it's a little bit harder to rehab from it. It takes a little bit longer than if it's someone who's younger and gets it. But I've seen patients of all ages with this. In terms of menopause, a lot of women who have migraines, you can get vestibular migraines. It's a very specific diagnosis. And sometimes with menopause, it actually improves it and you actually don't get dizzy as much.
Interesting. We did have a question early on from Frankie. She wanted to know if you could repeat the video again. Was there a part in the beginning which I was not able to, I forgot to push the record button. I get so nervous that recording things that aren't supposed to be recorded, but there was a video. This is what she wanted to see again, I guess.
Okay, let me see if this will work. Oh, it worked. Okay, can you guys see it?
Yes, I can see it. Do you want to put it on slides or slide presentation?
This is a full 3 months of food without needing any refrigeration or special storage. You're looking at.
With head movement, does fluid within the inner ear also move, informing the brain that a head turn occurred? However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. The Epley maneuver is performed to treat this posterior canal BPPV by trying to get the loose crystal out of the canal. This maneuver is started by turning the head 45 degrees and the body laid back such that the head is extended up about 20 to 30 degrees. If BPPV is present, eye twitching called nystagmus will occur. After 30 to 60 seconds, the head is turned 90 degrees to the opposite side
So
and
this is
held
the
for another
treatment
30
for
to
it.
60 seconds. The head is then further rotated another 90 degrees, accomplished by having the patient turn onto their side, which is then held for another 30 to 60 seconds. At this point, the head should be turned 45 degrees from the horizontal. When performing this maneuver, another individual can help with these position changes. The maneuver is then completed by having the patient sit up. So what's going on with these position changes? Essentially, the head is moved in such a way to manipulate the crystal to fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle into the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way and the maneuver will fail. It's also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal and the maneuver will fail. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV.
Okay.
I have a couple other things in the chat. No, I do not send slides, but what I do is I will post this on the library's YouTube channel, and they're there forever. Someone, Thora Zale asked, do you need a doctor's script to schedule an appointment? And someone asked, I find that in the past few years, weather plays a factor in affecting my vertigo episodes. And JC asks, does Medicare cover this? Right. And Tatiana said, I hear it, but I don't see it. No, we weren't able to see it. And Harriet said the same thing.
Okay.
So this was, I thought that was all we had, so I didn't say anything.
Okay.
There was no visual to it, but if you could answer about Medicare, maybe we can run it again and I'll be able to record it. Oh,
So,
JC said she saw it. Okay, all right, somebody saw it. All right, and also the thing about a script and about weather with vertigo.
yes. Okay. So in New York, you don't need a script for the first 10 visits or the first 30 days to come to physical therapy. However, if you have Medicare, you do need a doctor's script. Medicare 100% covers this. It's considered physical therapy. So if you have Medicare, come on in. And weather can affect this. I have heard that changes, kind of like with headaches also, changes in the barometric pressure within the atmosphere can sometimes change the density of the fluid in your ears and make you a little bit more predisposed to getting vertigo. Also, salt intake is a big one. They do recommend that if you commonly get vertigo, to reduce your salt intake. That also helps keep the balance in the fluid in the ear.
Okay, what about also being sufficiently hydrated? I know a lot of seniors have told me that they have to really work at drinking water. A lot of people, not just seniors.
Yeah, no, that all plays into it because let me see if I can get into a better picture. Okay, this is a better
And
picture.
I apologize that I forgot to record, but we got most of it.
So in this area here where the hair cells are, it's almost like there's like a membrane from this area to the rest of the canal. And the fluid, the density of the fluid should be the same in here and the rest of the canal. But when we're dehydrated or we're overhydrated, more when we're dehydrated, that can sometimes change the density of the fluid where the hair cells are versus the fluid in the canal. And that change in density, as slight as this is, can cause a little bit of movement in the hair cells. And that can make you feel a little dizzy. And that can predispose you to causing the crystals to come up off of the gel.
Elise says, my crystals were in a different canal and Elpley didn't work. I think maybe that's a spelling. I'm not sure. My therapist found my problem and helped me.
Yes, so your 3 canals, you have your posterior, your anterior, which are kind of like this, and that's more the up and down movement. You also have a horizontal canal, which is more side to side. The majority of the time, it's in your posterior canal. However, yes, it is common to get it in your horizontal canal where the Epley does not work. There's a different technique to change it. But it's the same concept. It's still a crystal in the canal moving the fluid. You just have to move your head in a different position because canal is positioned differently to dump it back in.
Okay, and Patricia says, thank you. Thank you, Patricia, for coming. I'm sorry about that. I didn't see the visual either, but somebody said they did, but I heard it and you kind of explained it by going through actually this, you showed how we did it. I did realize that we missed the audio to that. Let's see if I have any more. Okay, anyone else have any more questions? I will
No,
be pardon me?
May I just say thank you very much. This was really very informative. I really appreciate it. Thank you so much. Yes.
Thank you. I'll kind of go back
Okay.
to the info if you guys want to write it down. Did I go too fast? Was it okay?
Yes.
No, you went fine. I didn't record it right away.
No, it's
But
fine.
there
No.
you go. So anyway, that will be on the library's YouTube channel. And as I'm told, everything stays up there forever. But, and you're welcome to come and look at any of our things that we've recorded and put up there. Anyone else have any more questions? No, I guess not. No, that was fine. I didn't know anything about this, and I don't know. I do know that people suffer from dizziness and vertigo, and I haven't myself, so I never looked into it. But thank you, I appreciate that. And you're in Franklin Square, which isn't too far, and you also have an office, a basic office for New York Physical Therapy and Wellness in Cedarhurst, which is right here.
Yeah. So we've got Rob in Cedarhurst. I can give you guys, if you guys want, I can give you the Cedarhurst information as well. Would you guys like that?
Sure. We'll put it on the tape.
So it's 657 Central Avenue in Cedarhurst. And their number is 516-812-9575.
Okay, great. And you also, this company has got a new message. Hold on. Can you put it in the chat, please? Okay. That was from Tatiana. Okay, sure. We'll put it in the chat.
Why is it not popping up?
Should be down there at the bottom for you, or I don't know what you're on. It could be in the upper right corner too.
I don't know if it's just because I'm in the slideshow thingy.
Oh, I
There we
see.
go. Why this is. Give me it. I'll get there.
Okay. All right. Or you could dictate it to me, and my chat's open.
I don't know
Put
why
it in
this
if-
is. I don't know. It's being. Let me try. I'm gonna stop screen sharing. That might be it.
Probably.
Oh, that's it. Okay. All right. So I'll put it here. So I'll put my office information and the Cedarhurst.
Okay.
So.
This organization has a lot of different lectures. I chose this one. I just thought you'd be interested. So we can certainly have them come back, and I'll remember to push the record button from the beginning. I was getting so interested, I forgot.
That's a good thing, I guess.
Yes, it is. It was a wonderful presentation.
That's a
Okay, actually,
student.
I'm going to stop recording now.